Hi, my name is Rose Roach and I am chair of Healthcare for All Minnesota, a grassroots organization that is dedicated to reforming our healthcare system because unequal access to healthcare is an injustice. It is critical to remove the profit motive from our healthcare system and fix how we pay for healthcare so it is truly universal. Having been part of the healthcare justice movement for more than a quarter of a century, I have heard story after heartbreaking story about how the structure of our current system creates obstacles and barriers for patients to get the care that they need. People putting off life-saving treatment because they just couldn't afford it. People making the choice between filling prescriptions and paying for rent. People driven to bankruptcy because they needed life-saving medical care. It doesn't have to be this way. That's why I'm dedicating so much of my retirement to the fight for single-payer healthcare coverage that would be here in Minnesota via the Minnesota Health Plan. But I can't do it alone. It takes the stories, efforts, and yes, resources of all of us to get the Minnesota Health Plan passed and implemented. Working in partnership with other community organizations, labor unions, and elected representatives, we have a plan to fundamentally change the way that we pay for healthcare, making access to healthcare affordable for individuals, families, business owners, and government. Once we start allocating healthcare dollars to actual healthcare for patients, we can begin to work on care delivery, ensuring real health equity while safeguarding public health. Of course, this won't be easy. We are up against serious moneyed interests who prefer to profit off of our human suffering. But this issue is just too important. We must stay in the fight because lives are literally at stake. That's why Healthcare for All Minnesota is raising money during Give to the Max to fund a strategic statewide campaign that counters those moneyed interests and centers patients and providers in our healthcare system. We do that by passing and implementing the Minnesota Health Plan. I'm asking you today, please consider making a gift of any size that is meaningful to you today, so that Healthcare for All Minnesota can continue to have the resources needed to be on the front lines of this historic campaign to ensure guaranteed, accessible, affordable healthcare for all. Thank you.